you know how to speak with someone who has a cancer diagnosis. So can you give us some tips for people who have no idea what to say?
Yeah, I think the most important thing is not only for you to kind of just make sure they know that you're there, but just know that they can talk to you about anything, that you're there to listen. Try not to give them too much information or tell them what you think you know. Patients oftentimes are like, oh, my friends are telling me I need to do this or I need to go there. They just want someone who's going to listen, just someone who's there that they can say anything to, won't judge, won't give their opinion, just to be there to listen.
Okay, so when a woman has breast cancer, what are some of the things that they're going through mentally and emotionally that we may not be aware of?
Yeah, I think in the beginning, a lot of it is just the shock of finding out you have breast cancer. Often women either have never had a mammogram, they go for their first one, and then all of a sudden they're told they have breast cancer, or they've had multiple mammograms that have been, oh, you're fine, you're fine, you're fine. Then all so thinking they're going to go and they're going to get the same report that everything's fine, and then you find out, oh, wait, now I have breast cancer. So it's a lot of shock in the beginning. And it's a lot of fast movement all at one time. So it's you get an abnormal mammogram, and then within a couple of weeks, you need to get more imaging and biopsy, meet the doctors. So there's no time to really take a breath and think about what's going on. It's just boom, 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 getting the diagnosis. So it's a lot of I would say patients are scared often, a lot of anxiety. And it's not until actually I think they feel their best when they actually have a plan in place. Like, this is what we're going to do. And then they feel like, okay, now I can breathe and move forward. And as fast as we think things are kind of going, for the patient, it oftentimes feels slow. Like they'll have a diagnosis that the mammogram abnormal, but then they have to wait a week until they get the more imaging, and then until they get the biopsy, until they get the results. So it's a lot in the beginning, but patients oftentimes, again, it's just a lot of anxiety waiting for, and a lot of nerves waiting for all the answers.
And isn't it right that once everything is over and they become a survivor, aren't there a lot of emotional things they go through then?
Yeah, so I oftentimes tell patients that a lot of times the biggest nerves and the biggest anxiety comes after you get all your treatment, because you'll finish your, whether it's your chemotherapy or you'll get your surgery or you're on to the pill that you're going to stay on for 5 years. A lot of times at that point you're kind of like, what just happened the last year of my life? What just happened the last 6 months? And I find a lot of times that's when a lot of the questions, even I'll have patients who will say, wait, what kind of breast cancer did I have? It's just because it's so much emotion and so much kind of moving quickly in the beginning, that you don't even have time to think about what actually happened. So a lot of times it's after they get most of their treatment that a lot of the questions come and kind of just, wait, what just happened? And a lot of the emotions. And that's why I always tell patients, like, keep asking the questions that you think you should have asked in the beginning. It's okay to ask them 2 years in. Make sure you're talking to someone. Have a therapist if you need to. Have a good friend.
Yes. Such a change in their life. Every
Yes,
stage,
yes,
every step of the way. Yeah,
yeah.
that's amazing. Okay. Great info. Thank you so much, Dr. Levenbach.
No problem.